Hey friends, welcome to Life with Everyday Haley. Haley here, and today we're going to be talking about my health journey and my personal journey toward pregnancy. So, a little bit about me. My name is Haley. I'm 29 years old. I'm happily married, and I wanted to give you a little background on my health journey and my journey toward hopefully becoming pregnant and some of the steps that I have taken to get there. So, I was born with a rare condition found at birth called situs inversus totalis. Feel free to look it up, but it has kind of shaped my health journey in my life. And what it means is I was born with all of my internal organs in my abdomen abdomen and thoracic area. So basically right here, backwards. And I was diagnosed with that at birth. I was having some breathing issues, and they did some x-rays and found that at birth. I was transferred to a children's hospital because my condition at the time was not as well known. They determined that I was going to be just fine. I spent about a week there and I was able to go home. I did have to spend a year with a heart monitor just to monitor my heart healthy. Now, this condition can cause significant issues in your body. You can have a lot of lung infections, sinus infections, ear infections, chronic things like that. Luckily, I've been pretty healthy my entire life. I'm one of those lucky babies. Because of that, it is a genetic disorder. I have been told that I could potentially face some issues conceiving. There's nothing that scientifically proves that for women. You kind of just have to go with the flow and see what's going to happen. So that's my first portion of my health timeline. Okay, moving on. So we did some additional tests. We also did some genetic testing because since this is a genetic disorder, we did preconception genetic testing. If you're wondering what preconception genetic testing is, it is a genetic test that you can get done prior to pregnancy or even during pregnancy. It wouldn't be called preconception genetic testing if you're already pregnant, but it would be called, genetic testing pretty much. And that's where you and your husband can go and test each other's, DNA for genetic mutations. And if you match up, then if you're a carrier for something and your husband's a carrier for something, then you have a chance of having a child with the condition. So in our genetic testing, it tested for 500 conditions. It was a little scary, but it was something that I just really wanted to do for myself, my health, my future, just to give me a peace of mind. And we didn't have any genetic mutation matches. So we have a very, 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 very low risk of passing anything on genetically to our child. And that was a really positive thing. Now, it is really cool when you get your results back to see what you're a carrier for. I was only a carrier for this condition. He was a carrier for another common condition, which we were really shocked about, but I was not. So our risks are very small. They did tell us, if you have siblings, make sure that you fill them in on what you tested as a carrier for, because they could also be a carrier. So anyways, preconception genetic testing is really cool. Insurance paid for part of it, and it just gave us a peace of mind. So if you're interested in doing that, you can talk to your physician about it, your OBGYN about it. And if you're like me and you do have an underlying condition that is genetic, that can be a really good plan for your timeline. Okay, moving on from that. So we did that a couple years back, just before we even started trying to conceive. And something else about my health that has caused me to kind of put a pause or have to be very careful about my conception timeline is when I was 22 years old, so that was 7 years ago, I was diagnosed with rheumatoid arthritis. And for those of you that don't know what rheumatoid arthritis is, it is an autoimmune disease that affects your joints, causes inflammation in your body and some of your organs, and it's really intense. And I was a senior in college. I was just about to finish school, and this disease hit me out of nowhere. I'm going to post another video down the line just about my RA journey and what exactly all happened with that and the symptoms that I was experiencing, so that if someone watching my video has a similar experience, I'm a great resource to know what to do, how you get to a remission state and get your life back. I was put on a treatment called methotrexate, which is not safe for pregnancy or preconception or breastfeeding or any of that. And so I've known for years that when that time came where my husband and I wanted to have a baby, that I'd have to make a treatment change. I'll get back to that timeline in just a moment. Diagnosed with RA. So before I was diagnosed with RA, when I was in high school, I had really intense periods, to the point where sometimes I would have to miss school, to the point where I was just laying in bed with heating pad and ibuprofen and like nothing was helping. And this went on for a while, so I finally made an appointment. I think I was about 19 with my OB/GYN, and she did some blood work on me and said, yeah, we think you have PCOS. Your hormones are a little out of whack, and you're just having signs of PCOS. So PCOS is a condition where your hormones are out of whack. It causes issues with your uterus and causes, irregular cycles or really heavy cycles. It's hard for people to lose weight with PCOS, and they can, gain a lot of weight. It's about 1 in 4 women, so it's pretty common. So I was diagnosed with that. Now, I never had irregular periods before, but they were just really heavy. And I actually had never skipped a period. So to me, that's a good sign that, like, wanting to conceive, hopefully, like, my periods will be okay, but I don't know. So I've been on birth control since then. So that was 10 years ago. So I'm about to come off my birth control when this video is being taken, and I am nervous about it because of what it's been able to do for me. My periods have been really light. I have heavy cramping like the first day, but then it goes away completely, and I only bleed for like 5 days, and then it's done. And it's just like been a great period transition, and it's been like very consistent. It always comes the same day. I've just really enjoyed being on the pill. I've never had any pregnancy scares or anything like that. So that's my PCOS journey. Other than being on birth control, that's really the only issue that I've had, is the heavy periods. Now, about a year ago, I did a blood work panel, and it came back my insulin was really high, and that's very consistent with PCOS. And so I was put on metformin, and metformin is a pill that helps you process sugar and brings down your insulin levels, and is something that's very common as a treatment for women with PCOS. It's also used to treat diabetes. I'm not diabetic, but if I kept going down that path, I may have become diabetic because my numbers were pretty bad. I'm coming off my birth control next week, and I'll see what happens, and I'll let you know how long it takes my cycles to regulate and what my symptoms are. I definitely don't think there's a lot of information out there on the internet about people coming off of birth control and what to expect and like how it goes. So I've heard some stories from friends, and it really just varies depending on the person. In another video, I'm gonna do like a PCOS like deep dive into like what I've experienced, how you can increase your fertility and things like that. So let's get back to the RA. So I decided in 5 months ago that I wanted to get pregnant. So I talked to my doctor, my RA doctor, and I was like, look, I want to get pregnant and I can't take this treatment anymore. I'm aware. So what do we do? So he's been telling me for years about a treatment called Cimzia, which is a rheumatoid arthritis biologic treatment, which is safe for preconception, conception, and breastfeeding. So it will guide me through my entire journey. So he put in, a request through my insurance to approve it. Had a couple denials, took literally 3 months. It was exhausting. But finally, I got Cimzia approved. And so I started taking Cimzia, and it's an injection. I'm going to do a video talking about my Cimzia injection and my rheumatoid arthritis deep dive in another video. So remember to tune into that if you want to learn more. Started my treatment a month ago. I have to give my methotrexate time to leave my body before I can try to safely conceive. Other than the shot is really painful to take. Wow, it's really painful. If you are on Cimzia, bless your heart. It's really hard to take. My husband gives it to me. But other than that, I've been healthy. I've been happy. I've been feeling good. No flare ups. I'm feeling awesome. So, my plan is to come off my birth control, let my body readjust, and we'll start trying in about a month and a half. Like, I'm optimistic, but I'm like realistic. Like, this might be hard for me. So I'm coming into it with that perspective. I also was able to meet with a high risk pregnancy physician with my OBGYN office. And this was back when I was doing my genetic testing. And they have shared with me that I should have a normal pregnancy, like I shared with you. I shouldn't even be that much of a high risk patient. The fact that I have situs inversus doesn't even make me high risk, which is awesome. But having RA does. But they said I was on the lower spectrum of high risk patients. They also said that because of my genetic history, that if I'm not pregnant within 6 months, I can go ahead and make an appointment with the fertility doctor and talk with them. So that gave me reassurance as well. And there are fertility measures that they can do for you if you have situs inversus and PCOS. And they've shared with me that they're really glad that I did my preconception genetic testing, because now if something is showing up regarding fertility and it's not working naturally, that they now at least can kind of figure out what might have caused it for me. Okay, so let's talk about tracking ovulation and things like that. So I've been reading about tracking ovulation. Definitely going to be tracking my cycles when they come back. It's important to know, how long it is between your cycles. There's an app that I use that is awesome. It's called the Flow app, and I'll post it here for you to look at it. You can download a free version or pay for subscription version. But it allows you to track your period. It tells you the days you're ovulating and all kinds of things like that. It helps you track your pregnancy. So I definitely recommend an app like that for you to at least be able to help with tracking your cycles and ovulation. It helps you track your pregnancy. So I definitely recommend an app like that for you to at least be able to help with tracking your cycles and ovulation. Because once you're off the pill, you really have to pay attention to it, especially if you're trying to get pregnant. Because we know that as soon as you're pregnant, you want to seek medical care. You don't want to go long periods of time during your pregnancy and not know that you're pregnant. You want to make sure that everything's normal. You want to watch for signs of a miscarriage, signs of an ectopic pregnancy, and all kinds of things like that. And make sure that you're healthy. So let me show you 2 products that I've found that I will be using. I probably won't use them right away, especially this first product I'm going to show you, because the first product, I'll just go ahead and pull it out for you, is the Equate Early Ovulation Kit. It comes with 10 ovulation test strips and 1 pregnancy test. This kit, and I have a deep dive of opening this in another video for you if you'd like to learn more about how it works and how you use it. This kit will help you determine the best days in your cycle to try and conceive. And there is 2 days before your day of ovulation that are your best chances of getting pregnant. So the 48 hours prior to ovulation and what to do. So I probably won't use this kit the first month. I kind of want to wait for 1 cycle to come before I use this kit, just so that I know that, okay, like I got my cycle back, like let's see. And you can always buy more than 1 kit and just test yourself each month. It's just important to read the instructions so that you don't miss your testing window, because it does give you like days that you need to test. It's worth it. The other product that I have, and I recommend having these kind of in your stock at your home if you are wanting to conceive. This is the Equate 1-Step Pregnancy Test. This one says you can test 5 days before your missed period, and it has 2 tests in the box. So I went ahead and got this because if I think I'm pregnant at any point, I want to test. It also has instructions in here about the most accurate days of testing, and it gives you percentages of, okay, if you test this close to your period, your percentages will increase. So definitely test twice to make sure that a test is accurate. And once you get that positive pregnancy test, go talk to your physician. So that's where I'm at right now, coming off of birth control, and that's my health journey of some of the issues that I face. And I've done a lot of research about my health. I've talked to a lot of my doctors. We're all on the same page, and I've been given the green light of good health and the right treatments and everything to try to conceive. My plan is give it a couple months, and if it's not going well, contact my doctor. My OBGYN told me to call her as soon as I have a positive test, or to call her if my cycles are longer than 40 days in between them, which is a sign that something's not quite right. Or if I'm not ovulating. That's where I'm at. I'll keep you updated. And like I said, in upcoming videos, I'm going to do a deep dive into my RA diagnosis, what symptoms that came out, what to expect with that, as well as PCOS. And then I'll follow up with how my journey's going. Thank you for watching. Thanks for tuning into Life with Everyday Haley. There's a little bit of everything on this channel, and I'm happy that you're along for the ride. Feel free to like this video, leave me a comment about your journey, or if you have anything in common with me, and please subscribe to my growing YouTube channel. I really appreciate it and hope you'll have a great day.